Hello, everybody, and welcome back to our How To Corner. I'm Will Gray III, and this is another episode in the world of 3Gen Sports Science Institute. And in today's episode, we're going to talk about post-op ACL wound care. So, thanks everybody for pressing play, joining the talks. If you have any issues or things you want to learn about, concerning what we're talking about, we talk about a vast different amount of topics. Please, man, subscribe, comment, let us know, and we will definitely cover it. But I have some pretty good, cool content coming for you all in the next few days. We do a lot of wound care next few days, and talk about some services we offer. But in today's episode, we're talking about the ACL and wound care after surgery. So let's hop into it. What we will cover, man, we will cover the day after. We will talk about what to do at home and when to schedule. With the day after, when do we take the bandages off? Who takes them off? How to take them off? And we also talk about what to do at home. You need to abide by the precautions, expect to manage pain, right? And then when to schedule PT ASAP, believe it or not. We're going to dive into these three little topics here and try to give people some peace of mind, man, when they're coming home after the ACL surgery, because it's not as bad as you think it is when it comes to managing the wound care and doing it at home. The hardest part is just trying to get back to what you love. So let's talk about the day after, right? The day after, the bandages need to be removed. All of that post-surgical blood and beta iodine and all that crap is going to be on your skin. That's cool. You need to get those bandages off and replace them with other bandages, and just making sure that we don't have any excessive blood loss, right? If you feel uncomfortable doing so, then call and schedule your physical therapy evaluation before your surgery. You can go to physical therapy one day post-op. I've seen people have a surgery, personally myself, in the surgical room that Thursday morning at 8 a.m. and I saw him that Friday morning at 8 a.m. It really is not a need to take a break or not, schedule. You should schedule as quick as possible so they can kind of get you going and get you moving, right? The next thing, your therapist will handle it. They will handle it. The day after your surgery, if you schedule, the therapist will take care of your bandage stuff. And be prepared for the pain, right? If you don't experience pain, that's great, but make sure you follow your surgical precautions. And one of the gold nuggets is rent or purchase a cold compression unit if you can. With your pain and what you have going on, right? After the surgery, you may experience high levels of pain. The medication itself may not help, may not touch it. That's totally normal. What you want to do is get you a game ready unit or a cold compression unit of some kind, or a very cold ice pack. Elevate that leg, prop it up on a pillow, and caps it with that actual ice pack, and that will help with a lot of your pain. A lot of your pain comes from your swelling anyway. It's not just from the surgical procedure in the sense of the bones have been, drilled through. No, it's really a lot of swelling. Swelling causes a lot of pain. And like I said before, this is the best thing to help with the pain. So the day after surgery, get to the house, change the bandages, schedule your physical therapy evaluation in advance. Be prepared for some pain, deal with the pain, take your medications as you need them, but use cold ice, ice, ice. That will really help you with the pain. So what to do at home, right? I talked about day after surgery. I talked about some things to do at home. I'm going to, expand on that. So step one, take your pain medications as instructed. You will need to stay ahead of the pain if you have it. Cold compression units like Game Ready are golden. Like I said before, ice, ice, baby. Step two, wear your knee brace. Keep your knee brace on. There's no reason for you to come out of it. Keep it on unless you're trying to change the bandage. If you're trying to do it, be in a position where it's actually secured and propped up and nice and safe. Remove the bandage, but then place the knee brace back on, especially when you're about to go to sleep and you're up and about, you're moving around. Knee brace. Wearing your brace is not optional. Step three, move your foot as much as you possibly can. You're trying to prevent blood clots here, ankle pumps, moving the foot left to right, making circles. Very, very important. Helps to start muscle activation a little bit, decreases swelling in your calf as well as in your knee if you move it, with addition to some elevation. You want to try your best to, have your muscles working as quick as possible post-op, right after surgery. And also try to prevent, that swelling that's pooling in your leg. All of these particular things will really help you when you're at home. So do these three steps, do these three things when you're at home, and you will have a better time dealing with the pain, as well as understanding that you're trying to get your muscles back going, and then dealing with some of that swelling. Okay. So my last piece is when to schedule PC. Right? When to schedule ASAP, as soon as possible, man. Schedule it as soon as possible. You can start the first day following the surgery, like I said earlier. Regardless of what type of surgery you have on your joints, you will always need PT. Of late, I've had some people come to me, and maybe it's just in the state I'm in. I think that health literacy is super important. If you're curious where we're located in Mississippi. Health literacy is really important. When you have a surgery of any kind, you really need to make sure that your recovery happens. It's not just going to your follow up appointments, guys, especially when you have a joint surgery procedure. Like I had a guy, and it's kind of off the topic, but on the topic of wound care, post op, care for your surgical procedures. He had a foot fracture. Ended up having to have a foot procedure. He was basically non weight bearing, follow up in 4 weeks, and was not scheduled to have any rehab. Right, and I was okay, 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 cool, fine, that's fine. His bone had not healed back together in his foot properly. If you're aware of how bones work, right, and how certain things happen in your foot, you really need to promote circulation in your foot post-op surgery. Obviously, not trying to impact the incision or the surgical area itself in the sense of damaging it, but you need to try your best to bring circulation there, get swelling out, bring circulation to there, get swelling out. Try to move the toes, move the ankle, because you need stimulation of that area to occur. After that, you want to stimulate the area. Sometimes people use bone stimulators, or electrical stimulation units. That helps with bone growth. But the most important thing for bone growth, after you have released or been released from your physician and they see bone growth there, is some level of weight bearing, right? Putting pressure through the joint that allows the bone in the body to place bone or calcification or calcify that area to help with the bone to actually grow back. Now, if you're older too, if you're above the age of 65, that can impact your healing. Like if you have comorbidities, that can impact your healing. So when you actually are having surgery on joints, you need to have your therapist involved on some level, even if it's 3 weeks post-op. I've had people have shoulder surgeries, come to therapy first day, and then you're not scheduled to come back to 3 weeks just because you can't do much. As long as you do your wrist movements and stuff like that, you can't do much. People come back 3 weeks. I had people come back out of therapy for shoulder cuff tears and be there for the first 3 weeks. People are like, you can't do much. Like, yeah, but we can kind of range them, work on some tenderness stuff to try to get your tenderness down for you to be able to tolerate movement and stretching better. There's things you can do. So when you have a surgery, guys, you need to schedule your rehab. Trust me. I've seen situations where people have not had rehab and did great. I've seen more situations of people not having rehab and didn't do well. Okay. So set up your PT evaluation prior to surgery. Expect the first day to be very straightforward and simple. What I mean by that, when you get to your session, you may not do a bunch. You may get the bandage changed, get your brace checked out, make sure it's locked out, make sure there's not any type of things you need to be doing from a order standpoint, precaution standpoint. And then you're gonna proceed from there. The focus will be range of motion and muscle activation for the first weeks or so when it comes to your rehab after a joint surgery of any kind, especially ACL surgery. Range of motion, muscle activation, range of motion, muscle activation. And there's a lot of particulars that they're trying to get into, but I'm trying to not get into that today. I really want to just talk about what do you do at home the day after once you schedule your PT, because I get a lot of those questions all the time. When should I schedule my PT after ACL surgery? What do I do at home? What do I do not do? How to deal with my pain? How to do this? And I said, hey, I'm gonna make something to kind of inform people. So if you have any further questions, man, please come in, ask us questions, like, share, get involved in our actual comment section. We will answer. We will give you some information. And like I say, what I say is not, the end all be all, but I'm trying to give you a basis to start with. If you have any more specific questions, what I like you to do before you you know, get to that particular point, like, share, subscribe um, on the channel and give people opportunity to be able to learn something. But also visit us at 3Gen Physical Therapy on Instagram, and then you can book at 3Gen I gen.com booking, and just reach out to us, and we will try our best to be able to help you if we can. right? Give you information to be able to help guide you and answer some questions concerning different things. Because people have questions. You can always get your surgeon on the phone, and that's understandable. But we're here for you, to be able to assist you in that. So if you have any questions with post-op care, post-op things when it comes to the ACL, hey man, hope this particular how-to video helped you out. And if you have further questions, like I said before, comment, like, share, subscribe. You know, give us a shout. We will try our best to help you if we can. And with that being said, everyone, I hope you have a blessed one. I'll catch you in the next one.